We're pleased to be joined by our friend Dennis Wilson, President and CEO, Delta Dental of New Jersey and Connecticut. Good to see you, Dennis.
Good to see you, Steve.
A couple things. You were saying that there was a recent study by the Pew Charitable Trust.
That's right.
They did a study. What was it about, and why does it matter in terms of oral health?
The Pew Charitable Trust, and they do just some great research and some great work, both philanthropic and otherwise, but for the past several years, they've assigned letter grades based on their research in terms of how each state fares relative to its treatments of children from an oral health perspective. You know, how well are our kids being treated? Unfortunately, New Jersey got a F letter grade.
An F?
An F. And we're in the company of Wyoming and Hawaii in that basement.
Why did we get such a low grade?
We got such a low grade, and usually it's explainable because there's not access or the number of dentists or some other factor. Here it's pure regulation and pure policy. We have the most restrictive policy in the country as it relates to the ability for a dental hygienist to apply varnish to a child's teeth. And varnish are just a protective shield,
right,
which are 80% effective in preventing cavities. So it's a policy and regulation issue. We've taken some steps. New Jersey has taken some steps to ease the regulation a little bit. Now it's about enacting the right policy and making sure that the dental community is just aware of what they can do and what the restrictions are.
Okay, the other issue I want to talk about, diabetes and oral health.
Right. So 18 months ago, Delta Dental went to the dental board, the Board of Dentistry in New Jersey.
They regulate dentists.
They regulate dentists, and they regulate how and what dentists can practice. In other words, what is included under their scope of license. What can they do? So we just asked a simple question: can a dentist administer a diabetes test? Can they, you know, if properly certified and trained, do they have the ability to test for diabetes? Not interpret, not
test.
Test.
What was the answer?
Period. The answer was yes. And we found that, one, encouraging and amazing, because the dentist, we thought, has several more shots at bats, if you will, with the patient. If a patient is pre-diabetic, as an example, and by the way, there's over 2 million pre-diabetics in the state of New Jersey. And getting folks early,
I'm sorry for interrupting, Dennis, identifying it early, detecting it early matters. Why?
It matters because, one, you can just alert that patient that they are predisposed to diabetes, and two, just tell the patient, go see your primary care physician, go see your doctor, and go get information about the treatment of diabetes and put yourself in a program.
Real quick on this, Dennis, should people ask? I mean, we're in the business of giving out valuable information to people. You're saying, going to your dentist, you can ask, you know, can you test me for?
Sure. Here's where we are now. We did a beta test in two cities, Trenton and Newark,
right,
with a group of dentists.
Focused on urban areas.
Focused on urban areas, because we wanted to find out if there was something there,
right, and
there was certainly something there. So our next step is to take it to some, I think, forward-thinking customers of ours in the healthcare space, and asking them to integrate that benefit into their dental benefits program. And then we would train the dentist, enlist the dentist to make sure that there was adequate access for the patients, for the employees of these employers, these healthcare employers, to have this testing done. We think we're going to find something there. And then the next step is we're going to go statewide with this and make it a standard part of our benefit plan offerings.
Real quick, by the way, I should say that Delta Dental has an annual golf outing.
We do.
Glad to host that supports Special Olympics of New Jersey. Tell folks why that matters so much.
It's our 27th year in supporting Special Olympics, and we've given well over $1 million to Special Olympics through the course of those 27 years. And this
Great event.
It's a great event. We are a sponsor for the Winter Olympics Games, and it's our signature event for Delta Dental in New Jersey.
Also, you're very supportive of the work that we do at this independent production company as well. I just want to disclose that.
Thank you.
The pediatric piece, it's important. The pediatric care.
Yes.
What do we define pediatric? What age?
Usually, technically, it's really under 18, but for practical reasons, it's really under age 12.
What are the challenges? Biggest?
The biggest challenge is, quite frankly,
Because we have 13 and 15-year-olds, and I told them you were coming on. I'm like, you need to do the right. They're like, what? I did it 2 days. What? Every day, flossing.
Yeah.
Is it hard with this population?
It's routine is hard with this population.
Doing it all the
oral
time.
habits, doing it all the time, doing the right things all the time. And actually, it needs to be encouraged and talked about in the schools. It needs to be encouraged and talked about with the child's pediatrician, as well as pediatric dentist. The best place is to start early, before age 2. Bring that child to the dentist.
Go back to the school issue. In schools?
Absolutely.
To what degree is it happening?
Well, we have a kind of a fun program. We call it Captain Supertooth. Captain Supertooth is a superhero type character. Schools love it. He comes in, he's entertaining, he's an actor, he's on retainer with us, and he talks to kids about good oral health habits, what they should do, what they should look for, and so forth. Amazingly popular.
Is it about making it, I dare use the word, fun, Dennis?
It's about, to some degree, it's about making it fun. It's about brushing your teeth before you go to bed with your parents. It's a family activity, and it should be part of what you do.
Real quick, before I let Dennis out of here, the other thing I've learned from speaking to some of the dentists associated with the organization is that oral health is the gateway, if you will, to not just diabetes. Real quick, isn't it heart-related issues as well?
Heart-related issues, when a woman learns that she is pregnant, the second place she should go literally is to the dentist. First to her doctor, then to the dentist. Because periodontal disease, oral infections, tooth decay, things like that all matter when it comes to appropriate prenatal health. That's right.
Dennis Wilson is President and Chief Executive Officer of Delta Dental of New Jersey and Connecticut. Thank you so much, Dennis. Appreciate it.
Thank you, Steve.
Well done.
Thank you.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of Caucus New Jersey has been provided by the Turrell Fund, supporting Right from the Start NJ, Wells Fargo, Holy Name Medical Center in Teaneck, New Jersey, New Jersey Sharing Network, Fedway Associates, NJ Best, and by the law firm of Gibbons PC. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.